everyone. This is Focus 94.3 FM, and today we are here with the University Health Services to talk about halitosis. I'm in the person of Maureen Marshall. Who am I here with?
I'm Mrs. Selina Mensa.
Yes,
I'm Dr. Emmanuel Kojosu.
It's nice having you with us. So let's get straight to business. What's halitosis?
Okay. So before I answer the question, March is a Oral Health Awareness Month.
Okay.
And then on March 20th every year, we celebrate World Oral Health Day to raise the public's awareness of oral health and educate them on good oral hygiene practices. Okay. So this year, the theme for the World Oral Health Day is a happy mouth is a happy mind, which we believe an active or healthy oral mouth will boost a person's confidence.
That's right.
So the committee decided to talk on halitosis, which is also known as bad breath, and may hinder people's social interactions and as such. So if you ask me what halitosis is, it's commonly referred to as bad breath. Okay. And it's as a result of the breakdown of some compounds in the oral cavity, which releases volatile sulfur compounds. And these are responsible for producing the bad breath that we know of.
Okay. So are there types of halitosis? Are there types?
I won't say they are types, but we have what we call the physiological bad breath or early morning bad breath. Okay. So when you wake up from bed, because you've closed your mouth, you are not talking, it provides a conducive environment for these anaerobic bacteria, which are normal flora in the mouth, to act on the food debris that were in your mouth. And then they produce these volatile sulfur compounds. But what happens is that when you rinse your mouth with water, this bad breath is supposed to go away. It's not supposed to be present. That's a physiological bad breath. So the ones that stay, which becomes permanent, as a result of these volatile sulfur compounds that I mentioned. And they come in various odor. You can have rotten egg smell. You can have a fecal smell. You can have a fructose smell, like those with diabetic ketoacidosis. And then you can also have something like a urine smell as well. So they are not just that, but that's depending on the kind of odor that it produces.
All coming from the mouth.
All coming from the mouth.
One person.
Yes, please.
Okay. So how do you detect that you have halitosis or a friend has halitosis?
Okay. So thank you. There are myths about halitosis. Others say they can detect their own breath, which is not, let me say, a way of diagnosing halitosis, because it could be, it's not practical. Okay. It has to be detected by someone close to you, a loved one, or say a specialist or a dental surgeon. Okay. So to detect halitosis, we have professional way of doing it, which we call the odor smell test. We use the dentist stands in front of the patient, at least at a distance of 10 centimeters. So at that 10 centimeters, the patient counts 1 to 10. So you know what 10 centimeters? The foot through is about 10 centimeters. So 10 centimeters somehow is close to the patient's mouth. The patient counts 1 to 10. Then you smell. Then you grade the halitosis from 1 to 5 based on a scale, whether it's high, moderate, or minimal.
Standing that close, then the patient will be counting.
Then you smell the patient.
So unless the patient is done counting, before you can detect whether the person has halitosis or not. Is halitosis genetic?
Not really. It's not really genetic. Another myth is that people believe that cleaning your teeth helps solve halitosis, but that is not true. Wow. Because the bacteria responsible for producing these volatile sulfur compounds, they reside on the crevices on the tongue and other soft tissue areas of the oral cavity, like the gum and then the roof of the mouth. So you getting or inheriting these bacteria from your parent or whatever, that is not scientifically proven. But what happens is that each one of us sitting here, we have these volatile sulfur compounds in undetectable levels. Okay. It's only when they proliferate and they become abundant that the other person or the dental surgeon can detect that these are high levels of dimethyl carpan or hydrogen sulfide, and therefore the person has halitosis.
Okay. You see, halitosis, it's being bad breath. Can it be transferred from one person to another person through maybe sharing spoon like something?
I would say a big no.
Wow.
A big no. It's not transferable. So a wife transfer halitosis to the husband, no, or parents transfer halitosis to their children, or vice versa, no. Again, I will state emphatically that it is the normal flora in the person's oral cavity. These anaerobic bacteria, when you provide the conducive environment for them, so something like a dry mouth, then they proliferate. So as for exchange of saliva, say through kissing and then the rest, it's negligible. So having halitosis, so I won't say halitosis is transferable.
Okay, this is the part I'm very curious about. So what really causes halitosis? What causes halitosis?
What causes halitosis? Thank you. See, when we eat or we take in any food, there are some debris that are left on the tongue. Research has also proven that if you pick 100 cases, 51% of the cases are coming from the posterior third of the tongue. That is where food debris and these anaerobic bacteria, they reside. So what they do is they decompose the food debris and then produce these volatile sulfur compounds. So we have a lot of them. We have dimethyl sulfide, we have hydrogen sulfide, we have methacarpan, and then the rest. So when they produce, it is when they become at the detectable level, then that's when you sense that someone has halitosis. So it's anaerobic bacteria. So if it's a reaction, your food debris are left on the tongue, and then these anaerobic bacteria will break them down. And these are gases, volatile sulfur compounds. They are gases. So once they are produced, then they evaporate through the mouth, and then it's detected by individuals outside.
Okay. When we look at the human mouth, there are different parts in it. You can find the teeth, the tongue, the alveopalatal. Like, when you look at the mouth, can you get bad breath from tonsil stones? Like from your tonsils?
Okay, so that's a good question. Another fact about halitosis is that more than 87% through research has been proven to be from the oral cavity. That's where halitosis originates from. And then less than 10% originate from other sources. So these other sources include the sinuses. So someone who gets acute sinusitis can come out with halitosis. Tonsillitis. Someone who gets acute tonsillitis can come out with halitosis. Again, someone with diabetic ketoacidosis can also come out with halitosis. Someone with intestinal obstruction, the person can pass to. So where does the stool come from? So the gas that produce come back. Those with gastric esophageal reflux disorders, then when the food gets back, then it produces it. So there are some number of other sources of halitosis. So rightly as you said, tonsillitis or tonsil stones can result in halitosis.
Okay. So aside halitosis affecting a person's level of confidence, for example, if I have halitosis, obviously I wouldn't feel free communicating with other people. Aside it doing that, is there a different effect that halitosis has on a person's health?
Well,
like your general well-being?
Aside your diminishing interaction with the others, you see, the bacteria responsible for production of these gases, they reside in the soft tissues.
Okay.
So once they increase in number, then they start causing gingivitis. So an inflammation of your gum, then it progresses to now affects your bones and other supporting tissues of your tooth, which we now refer to as periodontitis. You get it?
Yes,
so
please.
it progresses to, it gets to maybe the bones where you end up with maybe an osteomyelitis or no. But that is a long way down. That's when you have a lot of bacteria proliferating. Your hygiene is very poor.
Okay. So can halitosis be treated or it can be managed?
It can be treated, but we prefer you prevent it. So how do you prevent halitosis?
Okay.
One, you have to tackle the source of the problem, which is on the posterior third of the tongue.
Okay.
I've already said that people believe when you clean your teeth twice a day, you help
Yeah.
which it does not work.
Wow.
Because the bacteria is residing on the tongue and other soft tissue areas of the oral cavity, which is the
So,
gum, the inner mucosa,
okay.
and then the roof of the mouth. Do you get it?
Okay.
So we have to concentrate on the posterior third of the tongue.
Okay.
And that means after cleaning your teeth and all the other areas I mentioned, the roof of the mouth, the inner mucosa of your cheeks, you have to clean the posterior third of the tongue. And that we don't use our toothbrush to do that. The toothbrush is not designed for it, so it might result in gagging.
Okay.
There's a specialized device for that,
even
which is
feel
known as a
like
tongue, yes,
vomiting.
vomiting. So we will recommend a tongue scraper. The tongue scraper is designed for that. And what you do is that you go from the posterior third from the back to the front 2 to 3 times after brushing. And then you rinse your mouth with your favorite mouthwash or water. Then you are good to go.
When we look at how mouthwash is designed and how toothpaste is also designed, that is mouthwash more effective in terms of fighting halitosis more than toothpaste or like anything?
I would say mouthwash really helps, but it only reduces the bacterial activities in the mouth. So after using your paste, and another thing that our boss did not add up is the use of the dental floss, which we use to clean in between the teeth after brushing. That one also get rid of food particles or bacteria in between the teeth. So after using the floss, then you use your mouthwash to rinse your mouth. That one is to reduce the activity of the bacteria in your mouth. So mouthwash is very necessary after brushing.
Okay. There have been complaints that when people use the dental floss, their gums begin to bleed. Does that mean the person has a problem orally?
Can I take? Okay. So there's a way of flossing.
Okay.
There's a way of flossing. You need to be taught how to. Other than that, you enjoy your
gum.
So you go in along one surface. Let's say this teeth. I go in between this. That means I'm cleaning the one on this side. When I'm coming out, I come out along the other adjacent tooth. You get it? And it happens, it goes on in turns like that. And if it's the first time you are doing it, you need to stand in front of a mirror, or else you injure yourself in the process. Yes, having a gum disease or such as peri or gingivitis can also cause bleeding whilst you are flossing. So that one is not advisable to be flossing with gingivitis. But you can injure yourself in the process.
Okay. Coming back to mouthwash.
Yes, please.
Is there a myth around mouthwash? Because people sometimes say it's not good. It's not even good for the teeth. Sometimes it doesn't even do anything to the mouth. Is there a myth around mouthwash?
Well, let me go back and say that toothpaste is a dentifrice. And when we say dentifrice, we are talking about a foaming agent plus abrasives and sometimes fluoride added to boost the strength of the teeth. And the mouthwashes are antiseptics. Antiseptics in the sense that they are used to reduce microbial load. So, and they come in various forms. We have chlorhexidine-based mouthwash, we have triclosans, and then the rest. And then based on the percentage of chlorhexidine in them, then it determines how much you should dilute the mouthwash. Mouthwash are very effective. Yes, they are very effective when it comes to dental treatment. It's been proven over and over. It helps relieve people of gingivitis and plaque-induced conditions and the rest. So they are very good. But again, you need to also be directed on how to use it. You can't use the concentrated form of the mouthwash. It will burn your gum. It will burn your gum. It has to be diluted. So a common mouthwash like Camaclos, which contains chlorhexidine gluconate about 2% or so. You take 10 mils of it and you dilute with 10 mils of water. You don't just keep the whole thing in your mouth. Then you rinse your mouth with it for 1 to 2 minutes. Yes, it affects your taste afterwards, but throughout the day, at the end of the day, it goes away. And you don't use these mouthwash for more than 2 weeks. I mean the chlorhexidine-based ones, because they cause discoloration of the teeth. Yes, they cause discoloration. There's a current one, I've forgotten the name, which doesn't contain the chlorhexidine base, and that one can be used as long as you want, just like the Listerines and so. That one you can use, but they don't stain the teeth. But once they contain chlorhexidine gluconate, they will lay deposits on the teeth. After more than 2 weeks continuously, it will stay in the teeth. So that's what I can say
That's
about it.
nice. Is there a specific type of mouthwash designed for people with halitosis, or someone with halitosis can just use any mouthwash?
Okay. Ooh. So there's this 3-step plan to a fresh breath. And one of them is the use of mouthwash, and I mentioned your favorite mouthwash. Your favorite mouthwash. So with halitosis, we're just trying to reduce the bacteria, the anaerobic bacteria in the mouth. They are supposed to be the normal flora. Yes, they keep the mouth in a healthy condition. It's only when they are out of their numbers, in excess, that they produce the halitosis we are talking about. So they are supposed to do. So you don't need to like vigorously, as if you want to treat the halitosis within a day. No. You see it, it's taken within a number of times. And then there are ways of managing halitosis. We have what we call the mechanical way of managing halitosis, which is the use of your tongue scraper. And it has been proven clinically to be the single most effective way of reducing halitosis or clearing debris and then bacteria from the posterior third. Then the chemical way of managing halitosis is the use of the mouthwashes. So there's no specific mouthwash designed for that. But we say you use your favorite mouthwash. Some ones those that are scented this way, others want this and that.
Different things.
Yes, please.
Okay, so when we look at toothpaste too, you see, we now see the charcoal toothpaste all around. Is there something specifically they do for people with halitosis, or any type of toothpaste is okay?
Charcoal toothpaste. Charcoal in essence is an abrasive.
Okay.
So every toothpaste on the market contains an abrasive, but they are in minimal quantity. When you come to the dental clinic for scaling and polishing, the polishing aspect, we use pumice. The paste that we are using, it has a high amount of abrasive in it. Do you get it? So we use a slow hand piece with a polishing brush and then to clean the teeth. It is done 3 to 6 months every year. Do you get it? So it's not like an active use of abrasive on your teeth. So the charcoal toothpaste contains, let me say, a high amount of abrasive. A high amount of abrasive. So it needs to be used cautiously. It needs to be used cautiously. I don't say you shouldn't use it. Yes, it's good. And then, believe you me, you need a peanut size of toothpaste to brush your teeth. You don't need to spread the toothpaste.
Then I've been wasting
from
mine.
one end of the toothbrush to the other. No. You are just wasting the toothpaste.
Okay.
You get it? And you should spend like 2 to 3 minutes in brushing your teeth. Some use a few seconds, they are gone, and then all that. So charcoal toothpaste, they are good, but needs to be used cautiously.
Okay, that's nice. Is there a home remedy for treating halitosis, even when the person hasn't visited the dentist or the doctor yet? Is there a home remedy for treating halitosis?
Home remedy, I would say, is the normal oral health routine that we have to go through. Brushing of our teeth in the morning, getting the dental floss, and after that we use the tongue scraper and the mouthwash. And another thing the person can also do to know the person has a good breath is blowing air into your palm in the morning. You can blow air into your palm, you smell the scent. Later, after brushing, you blow air again, you see the difference in the breath. That one, you are sure of reducing the bacterial activities in the mouth, and your breath is smelling good. So that one will help you in the house before coming to see us at the clinic.
Then let me add something small. Another crude way of cleaning the posterior third of the tongue is the use of a spoon. If you don't have a tongue
Which
scraper.
part of the spoon?
If you don't have a tongue scraper, yes. All you need to do is to stretch the tongue out as far as you can. so that you don't gag. Then you just use it
Just
to scrape it.
Like
So
where we used
yes,
to scoop food.
Yes, please. Just clean that parts like that. That's another good way of it. But as we said, we will recommend a tongue scraper.
Okay, so there aren't any specific home remedies, but
people have been trying these drugs that are sold on
herbal drugs
and stuff. The target is on the tongue, and specifically the posterior third of the tongue. That is where the anaerobic bacteria and food debris are having, and that's where it needs to be cleared.
She mentioned using your hand to smell your mouth, and after brushing your teeth, you do it again. Can someone with halitosis do that to find out if the person has halitosis?
Yeah, that's the home form that you can tell. If somebody has not told you have it and want to know it by yourself, you can just do that.
But you see that one is more subjective.
Yeah.
So an objective way of doing it is someone telling you, or you visiting a professional and then using the odor test to detect whether you have halitosis or not.
Okay. Let's get to this part. If I have halitosis and I come to you as a professional, what are the steps or what is done to make sure that this halitosis leaves me, I become free and feel confident again to communicate with people around me?
Where do I even start from? So the first thing is to take your history.
Okay.
And then from your history, we can decide where we want to go from. You see, taking in food substances like onion, garlic, they can affect your breath for a while. And then these foodstuffs, when they get into the stomach, the chemicals that they release in the stomach, they just enter into the bloodstream and evaporate through the lungs. So that one, it goes, though for some time you have your breath affected by taking garlic and then the rest. So from your history, you get to know whether it's from food substances or not. Then again, dry mouth. When you talk a lot, when you sleep with your mouth open. When you take certain medications, especially these diuretics, antihypertensives, they cause dry mouth, xerostomia. So this dry mouth also provide a conducive environment for the anaerobic bacteria to proliferate and then produce these volatile sulfur compounds. So from your history, we get to know where we are tackling. And we mentioned other sources of halitosis being sinusitis. So we ask you, have you been having frequent sinusitis? We inspect your throat, is there a tonsil stone, blah, blah, blah. So from then, when we detect the source, then we start from there. Oh, it's coming from the oral cavity. Then we book you for a scaling and polishing. That's the mechanical. So scaling and polishing, make sure we clean your posterior third. From there, we can prescribe you or put you on an antiseptic mouthwash, use it for a while. When you come in and it's still there, then we look for other areas. Sometimes we refer them to the ENT, the ear, nose, and throat. As I said, it could be from the sinus. Common cold can produce even bad
cold.
Breath. Yes.
How?
Because they are connected to your oral cavity. Then the eye, the nose, the mouth, they are all connected. Whatever thing that happens to one affects the other systems as well. So from there, we take it up and then we're able to help you. Our concern is that you go home smiling.
You talked about scaling and polishing.
Yes, please.
Okay, that is with the teeth, right?
Yes, please.
Good. So if this halitosis is coming from your tonsil stones, how is that one to dealt with?
So that is referred to the
ENT people.
They will have to clean that part.
Yes, sometimes they have to remove the stone. Okay. Sometimes you are put on antibiotics to fight the infections. Okay. So once the infection goes down, your halitosis goes away.
She mentioned surgery. So there's a point where you have to undergo surgery for your bad breath to leave you.
That is when it's coming from the tonsils. It's there that the ENT people, maybe you have treated for a longer period, it's not going. They will say then the thing is coming from your tonsils, so they have to send you.
It's not a major surgery.
It's a minor thing.
It's a minor surgery.
You can
that
go
has
home
no
the same
side
day.
effects.
No.
Okay. Since we are talking about oral health, let me ask this question. When is fluoride needed and when is calcium also needed?
In the body or in the oral cavity?
In the oral cavity.
Let me say the teeth or the tooth, it contains about 96% hydroxyapatite, calcium hydroxyapatite.
Okay.
So that's the component of the teeth. Therefore, the chemical formula is Ca10OH2PO4 into bracket 6 or so. That's the structure. So normally that's the structure of the contain the matrix of the tooth. When the fluoride or the phosphate part is taken off and is replaced with a fluoride, it forms a fluoroapatite.
Yes.
And it's believed that fluoroapatite is more stronger or harder compared to the hydroxyapatite. So that's why we've incorporated these fluoride in our dental, in our toothpaste. You see, so that's to harden the teeth and it makes it more resistant to brushing and other abrasive materials that we take in.
Wow. Thank you so much. This conversation has been very insightful. Is there any last words before we wrap up?
Okay, so I will say that first of all, I want to thank my committee members, Mrs. Regina Richard Wilson. I want to thank my in charge, Mrs. Selina Mensa. I want to thank Miss Hannah Nyame, and I want to thank Master Kelly Bossey, who also happens to be a committee member. We are not done with our work yet, but as courtesy, I want to extend a very big gratitude to them. And then World Oral Health Day is celebrated March 20th every year. And for me, I will never forget because my son was born on March 20th.
Oh.
His birthday is just a few days. Today is 17, so 3 days
3
from
days
now.
to his birthday.
Duncan Williams. So I'll never forget. And then I want to say a big thank you to the director of the University Health Service and the deputy director as well for granting us an audience. Yeah, we wanted to be heard as a dental unit, and he said, yes, I've given you the audience, so do what you want to do. So we want to thank them. There's a series of activities that we've planned this week long. So starting tomorrow, as we said during our lunch, we are doing dental screening and then scaling and polishing for hospital staff. There are plans in place to extend to the university community next year.
Yes.
Then on Wednesday, there will be a batch of hospital staff that will be attended to in that manner. There are oral health talks going on at the various units. Today we started with the public health unit.
That's
tomorrow
nice.
OPD, and then the rest will follow. And then on March 20th, which is the D-Day, we're having a dental screening and oral health education at Weweso MAGHS AMD school. Yes, please.
Okay, at Kenton Chrono.
That's where we are going. That's where the action is going to be. So we are inviting all to join us or join this movement as we spread happiness everywhere this year. Thank you.
Thank you for coming. To our listeners out there, be educated and take your oral health very seriously. This is Focus 94.3 FM. My name is Maureen Marshall and I've been your host. Thank you.